Lenny is by far the most undisciplined running partner I run with. She never follows the route. Her pace is inconsistent. She's either slowly lagging behind me or at a moment's notice can break out into a sprint. Oh, and not to mention her need to constantly use the bathroom at the worst possible times during our run. Now, even with all of this, I love running with Lenny. And by now, if you haven't guessed it, Lenny is my 3-year-old Pointer Shepherd mix dog. It's true her sighting a random squirrel or bird is enough to make her go haywire, but her ho-hum rambunctious personality is part of what makes our runs an adventure, and I wouldn't change that for anything in the world. She and my older dog Lola was the inspiration for this 2-part series, which subject focuses on running with your 4-legged friend. On this episode of the RVA Running Man podcast, I speak with Dr. Garret Pachtinger. Garret is a board-certified veterinarian specialist in emergency critical care and the co-founder and director of operations of veterinarian continuing education resource company VETgirl. In this episode, we discuss tips and the do's and don'ts of running with your dog. While there's some great tips provided in this episode, please be sure to consult your primary vet if you have any health-related questions or concerns concerning your pet. Just starting off, tell me a little bit about yourself, Garret.
Sure. So thanks for having me on the podcast. My name is Garret Pachtinger. I am a board-certified critical care specialist, veterinary specialist, I should say. I practice or live just outside of the Philadelphia area. And for those that are not terribly familiar with veterinary medicine, a little background on how I got to where I am, maybe, and how I'm different from some other veterinarians. Veterinary school, like medical school, is 4 years. So I did 4 years of my undergraduate degree. I went to Muhlenberg College in Allentown, Pennsylvania, and then I went to 4 years of veterinary school at the University of Pennsylvania. With that said, a little bit different human medicine and veterinary medicine. In theory, after my 4 years of veterinary school, I could have said, I'm done. I took my boards, I passed my national boards, and now I'm a veterinarian, and now I can go out and practice veterinary medicine, and I would be considered a general practitioner. So when you go to your veterinarian for what I would say are routine things, and sometimes not routine things, anywhere from vaccines to spay and neuters to more complicated things, those are your general practitioners. With that said, I elected to stay on a little bit longer and get some advanced training. So after my 4 years of undergrad and 4 years of veterinary school, I did a 1-year internship, general rotating internship in medicine and surgery. Then I did a 1-year fellowship in emergency and critical care. And then after that, I did a 3-year residency in emergency and critical care, and then took a several-day boards examination, thankfully passed, and then became a board-certified veterinarian in emergency and critical care.
Tell me a little bit about VETgirl and how does it work?
It's a great story. So if we go back about 10 or 12 years, we'll start there because I think around that time, technology started to pick up. If I date myself a little bit now, I'm into my 40s. And when I was a student, it was dial-up AOL. That's what I had growing up. We didn't have these crazy fast internet speeds. We didn't have these webinar platforms. We didn't have the technology that we have now. So about 10 or 12 years ago, a business partner and I got together and said, you know what? We think technology is shifting. We really want to change the way people get to learn. What I always joke or say is that the best education, the best webinar, the best lecture, the best topic is only the best if you're there. But what happens if you missed it? Or what happens once you leave? How do you take that knowledge with you? So we said there's got to be a better way. There's got to be a better way to teach. There's got to be a better way to provide education. And we also recognize that not everyone has the same access to education, not only in North America, but around the world. So we said with this technology, we're going to be the first to provide a really robust area of online education for all veterinary professionals, whether they're veterinarians, nurses, practice managers, et cetera. So we took the plunge, and her and I created a company called VETgirl to provide online education. And we do in-person conferences as well, but our major mission is online education, providing that clinically relevant, practical, yet cutting-edge education. And you may be saying to yourself, I don't look female, I don't sound female, so how does the name VETgirl fit into me or my dynamic? And this may or may not surprise you, and I know I keep saying this, but veterinary medicine is a fun and interesting field. Most veterinarians this day and age are female. Okay. So it didn't always used to be that way. So if you go back 20, 30, 40, 50, 60 years, it was a male predominant field. But over the past, I'll just say about 20 years, it's really shifted a dynamic. In fact, when I was in veterinary school, and I was there at University of Pennsylvania from 2001 to 2005 as a student, and then stayed on to do my advanced training. But in my class, about 110 students, there were approximately 10, 12 guys. Most were female. There are some veterinary school classes that are 100% female, or have maybe just a handful of guys. So it really has turned into a female predominant field. That's why VETgirl became something that we were excited to use as a name. It was polarizing. It was different. We always joked if we named our company Veterinary Online Education, that'd be pretty darn boring and maybe not so interesting to join, right?
Yeah.
And around the time where we created the company, the word girl, and I put that in quotes just to emphasize in a sense on video, but the word girl was very, very popular. There was Skinny Girl Margaritas. There was Goo Girl, which is a offshoot of Google. There was Run Like a Girl. There was a whole Nike campaign. So the girl name actually is a very, very positive thing. And really, I think outlines our field quite a bit to be a female dominant and driven field these days. In fact, as I said, I'm the anomaly. I'm the weirdo that's a male at this point in veterinary medicine as it dwindles down to being a heavily female dominated field.
The reason I have you on the podcast, again, me being a pet owner and me being a runner, I do take my younger dog on runs with me. And the question has been a topic in some of the run groups that I've been part of whether or not, whether or not it's a healthy thing to take a dog on a run with you past 1 mile. And I thought speaking with you would be an excellent opportunity to get an expert opinion on maybe some tips that runners or pet owners can have before just basically taking their pet out and not realizing some of the things that we may want to watch out for. The first question I have for you is it a good idea to take your pet on a run over 1 mile?
This is a great question and a great topic. And I think the first thing that I would say is exercise is very important. And similar to people, obesity is absolutely a problem in our pets and in the veterinary field that we deal with. In fact, as I mentioned, general practitioners, they're your front line and they deal with this question all the time about pets' health and obesity. And if we boil it back to say exercise, right? I definitely think exercise is a good thing. Like people, though, we have to recognize that it's going to be very individual dependent and maybe unlike people, potentially even breed dependent when we talk about dogs. So when we talk about, is it safe or healthy or acceptable to run over 1 mile, I think that's going to be multifactorial. And the first is, the way I think about things is breed. Okay. Let's talk about breed. There are certainly breeds that I would find likely to be more acceptable for longer runs, and some breeds that either are going to have much shorter runs or maybe shouldn't run at all, depending on the heat and other things that we'll chat about later on in this podcast. But the 1 mile to me isn't a limit that I worry about in a sense of that's the tangible line that we have to put down on our paper saying you can't go more than that. We have to stop at that moment. Because I think the other thing that I would mention is just like people, I do run, probably not as often or as long as your distances, but I think about it for myself. If I go on a period of time where life gets in the way, I have 3 kids and we have sports and my wife's practice and my business. And there are just times where life gets away from me and I'm just grinding at work and I don't have time for a couple of weeks. I get back on that treadmill, I'm not going to be as active or as ready to run longer distances. I have to work back in that again. Or let's even say if you're somebody that runs during the summer and not the winter, if you were a sedentary on that couch for a long, cold winter because you live in Minnesota and you go out on that first spring day, you're probably not going to be ready to run 10 miles on that first day. You need to work your way up to that. And I would say regardless of the age or breed or other characteristics that we're talking about, the first general principle that I think we should recognize is training and acclimation. They need to acclimate to whatever distance you're running with them. Maybe the first time you run with a new dog, you run half a mile or a quarter of a mile. Pick up on their cues. Do they keep up with you? Do they lag behind? Were they excessively panting? Did they have other issues on that run? Did they look like afterwards they were limping a lot? Right. All these things you need to take into account when we think about the length of the run, the distance, all those things, but work your way up to it. No matter what, you could have said to me at the beginning of this conversation, is it safe to run 2 miles or 5 miles or 10 miles? What's my limit? And my answer would likely be the same. We have to figure that individual out, just like you have to figure that person out and decide what they're capable of, and then try to work them up to that, help them acclimate, help them train up to that level to get to that distance or speed that you're looking for.
And using that method, is there some signs that would be an indication that your pet or your dog has reached that point where they can go a little bit further? What are some signs that the owner can look for to see whether the pet is ready for the next level?
Great question. The first thing that I'm going to look for is, are they keeping up with me? A lot of the dogs that we run with, and I'm sure it's similar with you, they often try to run ahead of you or at least to your side. They're not lagging behind, and you're not pulling on their leash to help keep up. And so check their cues. Are they running? Are they looking back at you like, let's go some more. I'm so excited. Are they keeping up their pace? Or are they slowing down? And as a result, you're having to slow down as well. When you watch their gait, meaning how they're running, is there any limping, any favoring of limbs? Watching them breathe. Now, granted, I expect even most trained dogs on a run to start breathing faster, just like we will, or pant for that matter. And we'll talk about that in a minute. But watch how they're breathing. Watch how they're panting. Do they look like they're breathing and panting as you would expect for that degree of the run you're on? Or are they breathing too fast? Are they panting excessively? Is their gum color not a healthy pink or sometimes even a little bit of a red color? Does it look excessively bright red? So we call that hyperdynamic, or even on the pale side, and that would be a weird thing to happen. But watch them behave. Are they energetic? Are they active? Are they like pulling you in a sense? Do they want to go forward? Is their gait normal as you would expect? Any limping, lameness, slowing down, stopping?
Okay.
Those types of things.
Okay. And weight, age, are those things that owners should take into account when it comes to the physical fitness of the dog?
Sure. And if I was going to use a medical term, for example, and a patient got brought into me and it brought into me for a problem that I diagnosed, let's say, as being diabetes, I would use a term as saying comorbidities. Comorbidities means what other illnesses or diseases do they have that can make diabetes worse? So what are the comorbidities, in a sense, to running distances? And I think age is one of them. And I always joke, whether we're podcast or in practice, age is not a disease, but at the same time, with age, I start to think about other things. So depending on the age of the pet, just like an age of a person, is their heart healthy enough to do this? If I had a relative that had heart disease, no matter if they lifted weights and they're strong, or they had, maybe that person with heart disease shouldn't run 5 miles. What does their cardiologist say? Right. If they are overweight, joint disease, right? A lot of dogs, especially larger dogs, weight is a significant concern with their hips and joint disease. So I have to worry, are they obese? And as a result, are they putting more strain and stress on their limbs, on their joints, on their bones? So while weight, you could argue obesity is a disease, but while weight doesn't really mean they can't run, while age doesn't mean they can't run, those are things I take into account. Now, I can tell you, when I gain a little bit of weight from not eating so well during the winter or not running as much, when I get back on that treadmill, I will tell you, I'm huffing and puffing a little more than I should. And when I lose those 10 pounds, I can feel it. Losing those 10 pounds, I can run a little faster, a little longer. The same thing with pets. And so keep that in mind, as what I would call comorbidities, or things we need to worry about to say, should they run as far or as long, or sometimes in hot weather. So I promised I'd come back to this when I said panting, and your weight reminded me about this. Dogs don't sweat like people do. When we run, we perspire pretty much head to toe, right? And the point of that is that you expect that to get rid of some heat. There are several ways that helps get rid of heat, but when wind comes and blows against your skin, when you have the perspiration, that is convective cooling. That is an efficient way of cooling. Dogs don't do that. Dogs don't perspire that way, maybe a little bit on the pads of their paws, for example, but they don't perspire like we do. So how do dogs get rid of heat? They pant. It's the same way. Convective cooling, their mouth, there's liquid in there, there's water, there's saliva. They pant away the heat. Okay. So that's why we talked about the breathing, on how they're breathing. But the other comment I really wanted to get into here, because I think this may be one of the more important things we talk about with dogs and running and complications potentially. What we're watching out for is heat exhaustion. Just like people can get heat stress, heat stroke, and heat exhaustion, dogs can as well. Remember, they can't perspire, they pant. The worst times of the year for dogs, or the worst days for them to run or have excessive physical activity, heat is a concern, don't get me wrong, but humidity is really the bad thing. Because if it's a very humid day and there's moisture in the air, there's no real difference of the moisture in their air and the moisture in their mouth to dissipate that heat when they pant. So it's not only heat, it's humidity. And I would also tell you that I think it's a combination of things. One is, most people are smart enough not to run their dogs for 10 miles on a 97-degree August day. I would also argue that by that time of the year, you've probably acclimated your dog a little bit, and their body has probably changed a little bit to become acclimated by the end of August. But from an emergency room perspective, as a critical care specialist, I will tell you the greatest number of heat exertion, heat stroke, heat exhaustion cases that I see come in the ER are springtime, like your May and maybe early June, because people get all excited. Maybe even March and April, quite honestly. People get all excited because it's been a terrible winter, a lot of snow, their dog's been inside, and it's that first 75-degree spring day, and people get so excited they throw on their running shoes and their tank top and their shorts, and they take their dog for a 5-mile run because they can't wait to get outside. The dog is not ready for that, and they come in heat stroke, which is a life-threatening illness, no question. And they say, but it was only 75 degrees. Your dog's been sitting on the couch for 4 months because it's been snowing and it hasn't gone for more than a leash walk to pee and poop outside. And now you just took him for a 5-mile run on the first nice day. Worst time of the year. And it's not, again, not the temperature or the humidity then. It's they haven't acclimated like we've talked before. They haven't worked their way up to that longer run. And I don't want to make it sound like 5 miles is the concern. It could be a 1-mile run for that breed. And with that said, I should comment on breed, if that's okay with you.
Yes, absolutely.
Breed is something we should talk about, because you mentioned you have a couple of dogs, and I'm sure your 2 dogs, maybe at the same age. I know you said one older and one younger, but they were the same age. They probably acted a little bit different if they're a little bit of a different breed. The breeds that I will caution you on, that if you're an avid runner and you say, you know what, I want to get a dog because I want a running partner, what should you likely avoid? Remembering there's always going to be variations, right? There's always going to be differences. Not every person is alike. We could both be 6 feet tall, 187 pounds, but you run 20 miles and I can't get through 3 miles, right? So there's always going to be variation. But the breeds that we should really, really worry about are your flat-faced or squishy-faced dogs. The medical term is called brachycephalic. Think about your pugs, your bulldogs, sometimes your Boston Terriers, but their faces are like the squishy face dogs. And they have, remember that I said the way they get rid of heat is panting. Their squishy faces, it's not just their face. They have a whole different breathing apparatus change, let's say, than a golden retriever or a Weimaraner or a Doberman, for example. What those squishy face dogs often have is one of 4 different things. They can have all 4, they can have 1 or some of them. First thing they have is stenotic nares. So their nose is often pinched in tight and they don't have big nose openings to take good deep breaths. They have what's called an elongated soft palate. So if you put your tongue to the roof of your mouth, you feel that's a hard bony palate. What you probably can't feel unless you have a super long tongue is a floppy piece of tissue that goes back, that often sits way, way back in the back of your mouth. Breeds like that often have an excessively long or floppy one that actually covers up their airway. And the more they breathe and the harder they pant, that tissue gets inflamed. So it's kind of like that snowball rolling down the hill. The harder they breathe, the more they pant, the more inflamed it gets, the thicker it gets, the harder time they have breathing, the harder time they have panting, the thicker it gets for more inflammation. So it gets worse. So they have a closed up nose, that long, soft palate. They also have number 3, what's called everted laryngeal saccule. So it's not exactly the same, but think about the tonsils in the back of your throat. Those get pooched out from inflammation and pinch off and close off the airway. And the last thing they have, their trachea, their windpipe, is more narrow than some other dogs. And again, they don't have to have all 4. They can have some of those things, but that comes a concern where based on all of those things, their breathing is just not efficient. It is very inefficient. As a result, they often have terrible times breathing, especially hot and remember, humid weather, and certainly excessive activity like long runs. So those are not great breeds to have. Good, better breeds often are, everyone thinks about your greyhound. They are those greyhound type, whippet type dogs. They're born to run. Pit bulls, depending on the distance, Weimaraners, some of even your Alaskan breeds like your Akitas or Huskies are great runners as well. We just have to worry a little bit about their temperature, right? Because they have furry,
big coats.
Thicker coats. But they're actually not bad runners. Think about your Alaskan sled dogs. Those dogs run forever in the right environment to keep them safe.
Right. So for the dogs that you consider not good breeds to run with, how do you keep them active without putting their health in danger, since they don't have the best, most efficient breathing?
Great question. And the first thing I would say is I'm not telling you not to run a bulldog or not to run a pug or a flat-faced dog. Okay. They can have that type of activity. And if you watch them, they'll play and run around in your backyard. But I would argue, if you think about it, more often than not, they start panting or want to lie down faster than your golden or pit bull or greyhound. Think about the time of day we're going to run them. So we're not going to run them in the middle of the day when it's the hottest. We're going to run them early mornings or late at night. We're not going to pick a very heavily humid day, regardless of the time of the day when they run. And then also remember, we're going to acclimate them. So we're not going to take them on a 3-mile run to start. Maybe we'll take them on a 1/4 mile run.
Okay.
Keep it their pace. Slow them down. Make sure they have water, right? Make sure you have a little water. Sometimes they have doggy water bottles or a collapsible water bowls that you can attach to your fanny pack or hip band or shorts. So make sure you have some water, maybe stop a little bit more frequently, but they need exercise. In fact, some of those breeds, we worry they don't get enough exercise, so they become obese, and obesity actually worsens some of their airway issues. So it's not that they don't need exercise or can't exercise. We just have to be a little bit more tolerant. Think about, and I'm not saying they're elderly, but think about an elderly person. An elderly person needs exercise as well. What happens if an elderly person doesn't get exercise or is bedridden? Not only will they get obese, they'll also lose muscle tone, they'll lose muscle mass, and they won't be as great of a person or pet in this example for themselves as far as their health. So slow it down with them. Time of day, humidity, think about those things at their pace, shorter distances, but they need activity as well.
Right. As far as in my state, you have to have a dog leash. Is there a preferred tethering device that a dog should have, harness or collar, when it comes to running?
Great question. The first thing I would say, I think both a collar or a harness are appropriate depending on the breed of the dog and their willingness or energy level. So a couple of big things. One thing I would say that I really don't enjoy are those flexible, retractable leads.
Okay.
I don't think they are acceptable or should be used. And here's why. I'm not going to bore you with case examples of dogs that I saw come into the ER too often for getting injured on a leash. I've also seen people that get injured because the leash goes zzz, and they go to grab onto it and they get lacerations of their hands, but you just can't control them. I understand the love affair with them. It's nice to give them some freedom and flexibility, but you want really that dog I'm sure you would agree, only a couple of feet at most away from you for safety reasons, especially on a run, to help direct them, to help move them, to help monitor them. You don't want them getting 20, 30, 40 feet away from you. And I've seen some of these leads go that long. You want better control.
Yeah.
I don't like also, especially for runs like prong or electric collars, I think a flat collar and or a harness. I would argue that you'll get a sense of how they're going to tolerate it. For example, if you put a flat neck collar on them and they're constantly pulling against you and gagging against themselves because they're pulling so heavily, maybe a harness is better for them to help control them. Personally, I like a harness a little bit more for a run because I think it doesn't put any pressure on their airway while they're trying to breathe, and it gives you some good body control over them. But I really have no problem at all with either a flat collar or a harness. Again, I like the leash only being a couple of feet, not that long leash that you may go on a normal walk with them, and certainly not a retractable lead, because I think it gives you better control of safety and security so they don't go running off towards a squirrel or running off in the direction of a car if you're running on a road, for example. So just a couple of feet, but I've seen some great options, both flat neck, or harness.
And we've touched on this pretty much the whole episode. But I'm gonna go ahead and fire the question off anyway. What do you think is the most important thing owners should consider before taking their dog for a run?
I don't know if I can say just one. I think what I'll review are the three things that we mentioned before. One is think about your dog's overall health first and foremost. I know, whenever I go to the gym and I look at a piece of gym equipment, or when I go to my treadmill, there's always a sticker on there that says, consult your physician before using this piece of equipment if you have any questions. And really what that is sort of a CYA, cover your rear end, as far as the gym equipment or the owner saying, are you healthy enough to even think about using this piece of equipment?
Right.
Should I be doing shoulder exercises if I have a torn rotator cuff? Probably not. No, I think I'm smart enough to know that, but consult your physician, and my physician would say you probably shouldn't do that. So number one, think about your pet's overall health. If you have any question, I think your best authority is your veterinarian. Ask them based on the knowledge of your dog, and they'll have knowledge because you have gone there. You will have a relationship with them. They'll know your dog's age, breed, past or current illnesses, things that have happened before. Is my dog safe to go on a run? So again, dog's health. Number two, that goes into, let's say, dog's breed. Think about the dog's breed. Is this breed a breed where it is acceptable to go on runs, or are there things that make this breed inherently more concerning? As I said, the dolichocephalic are the ones that have the long noses, your Goldens, your Dobermans, your Greyhounds, your Whippets, your other Sighthounds. Those usually have a better time running because they have a better breathing apparatus in a sense, whereas your squishy-faced brachycephalic, pug, bulldogs, their breathing is going to be more inherently concerned for longer distances, heat and humidity. So number three, I would say, is environment. Think about the environment in which you're going to be running your dog. We mentioned two already, heat and humidity. The other one that I'll add that I didn't talk about yet is terrain. So think about the terrain that you're going to be running, and is your dog suitable for that? A couple of things that I'll mention as far as terrain is concerned. One is heat. So if you're going to be running on the pavement or concrete, you wear shoes. Now, I know there are some doggy shoes you can put on them, but most of the time we don't put them on. Our dog just runs on concrete. I usually tell people, put your hand on that concrete. If you can't keep your hand on that concrete for 15, 30 seconds comfortably, that's too hot for your dog's paw pads. Right. The other thing, when you think about not just heat, think about the terrain itself. If you're doing trail running, here's an analogy. If I first start playing the guitar and I have baby soft hands, I'm probably not going to feel so good after the first couple of weeks, but eventually I will likely build up a callus if I'm strumming with my fingers, because over time, my hand is acclimated to doing that. Maybe the first time you trail run with your dog, it is a shorter run. Get their paws ready for that rougher type of environment, because you always have to worry, are they going to get scratched, scraped, or even cut if they have softer paws, they're not used to that type of environment. And I could argue the same thing goes towards concrete as well.
Yeah.
I've unfortunately seen many cases where the dog has gone on a run and it's either been distance or heat related on that concrete or pavement, and they come in and their paw pads are essentially abrased or eroded down because of the heat and abrasion of the slapping the pavement over and over. So environment, I think, would be other. So if I remember correctly, I said, think about your dog's overall health and consult your veterinary professional if you have any questions. Think about your overall dog's breed or overall characteristics. Are there any inherent concerns, even if your dog is in quotes healthy, or is there breed concern? And then again, think about the environment in which you're going to exercise your pet.
We're right at our time, Garret. I think we covered some really good topics here, and hopefully, my listeners can take some really good tips away from this, and I think that they will. But again, thanks for participating today, and good luck with VETgirl and some really good and awesome things that you have going on there.
I appreciate it. Thanks for having me on the podcast.
Thank you to Dr. Garret Pachtinger for participating in this episode. If you want more information about VETgirl, please visit vetgirlontherun.com. On my next episode of this series of Running with Your Dog, I speak with sports medicine veterinarian Dr. Patrice Mitch of Canine Sports Medicine and Mobility. If you like this content, please subscribe to the podcast on any of your major podcast distributors, or you can follow me on YouTube, which all you have to do is search RVA Running Man and you should see me. So please subscribe there, or you can follow me on the website, www.rvarunningman.com. Until next week, runners, please be safe on the roads and trails. We'll talk to you later. Peace.